Dr. Asli Malhotra is a leading NHS-trained cardiology consultant, also the author of the book, The 21-Day Immunity Plan, who joins us now. Doctor, thanks ever so much for your time today. Tell us about this book, The 21-Day Immunity Plan.
Yeah, Colin. So I've written this book. It's just published today. Thank you for mentioning it. And basically, the message of the book is that we know that poor metabolic health, which essentially is conditions related to excess body fat, even people with a so-called normal body weight, body mass index, is linked to poor immune health. And from my own analysis of the research, from clinical studies, from my own experience with patients, the good news is through lifestyle changes, you can rapidly improve these risk factors, if you like, associated with many of these conditions, but also very likely help support normal immune function and reduce the risk of complications from viruses such as COVID-19, but many sorts of infections. So I think one of the messages that I'm trying to convey through the book is that if people start now, within a few weeks they can notice significant changes in their health markers. They'll feel better, they'll be happier, and it's very likely they'll have a more robust immune system, all related to the kind of foods people are eating, the amount of exercise they're doing, their stress, and their sleep.
I'm here at my London abode in one of the mansions in Kensington, and who do I meet? Only Dr. Asli Malhotra again.
Good to see you, my friend. Always great.
Great stuff.
I think last time we met was Santa Cruz CrossFit.
Yeah, actually, it was all the way over in the west.
Just before the whole coronavirus hit. It was
just before.
January.
Yeah. And now look at us. We're all going around in masks and whatnot. So your new book, which I got from you, thank you, the other day, The 21-Day Immunity Plan, and I read it all in one sitting. I do read fast. But the beauty is it's not too complex. It's very approachable for the layperson, and it doesn't go through loads of references and science. It just gives you what you need to improve your immune system functionality. It's not like boost your immune system, right? It's all just basic science as to how you would get far less severe outcome from any infection because you'd be more physiologically healthy. So I don't know, where do you want to start with this?
Yeah, well, it's interesting. I mean, Ivor, I had to, this was written at quite short notice. And the way it came about, because a lot of people are saying what triggered you writing this book is, like you, we had been discussing when the whole pandemic had started off in China, it was quite clear, both looking at data in China and in Italy, that people who were adversely affected from coronavirus, people that unfortunately succumbed from it, were people with chronic conditions. Certainly, there is a significant biggest risk factor is your age, but almost 99% of those people that died who were even elderly had some underlying chronic condition. And when you look at that, most of those were related to poor metabolic health, underlying metabolic health, and it's very clear in the literature. Something I've known as a doctor, as an practicing doctor in the NHS for almost 2 decades, that people who have poor underlying metabolic health, which we'll define in a second, are also vulnerable to infections out with before even coronavirus is around, So chest infections, pneumonia causes a huge stress on the healthcare system. And it's like we kind of knew it as the medical profession, but no one's really joined the dots and thought, actually, we've been focusing for years on this diet-related disease epidemic that's putting stress on many Western healthcare systems. But one thing that people suddenly have realized is, actually, if we get people's metabolic health right, which would be great to prevent, people getting type 2 diabetes and heart attacks and strokes and all the other comorbidities, Alzheimer's, dementia, it would actually very likely reduce the risk of people being admitted with severe infections as well. But it was quite clear, the data seemed very clear with coronavirus. So then what happened was, I'd been on Sky News, I'd written an article in European Scientist about it, and the Sunday Express, and then I wrote an article in the Telegraph, and it was asked to go on Good Morning Britain. And at that point, up to that point, I'd written a couple of times saying that our Prime Minister, Boris Johnson, most likely became sick from coronavirus because of his weight, or certainly that was a very big risk factor. And then that became widely publicized. And my publisher, in fact, I was in the middle of writing another book, which was supposed to come out anyway next year on statins. I won't give too much, cholesterol and statin, I won't give too much away yet on that. And I was halfway through that, and she rang me, Rowena, and said, Asim, stop what you're doing. Could you write a book? You've been very outspoken about this. You seem to have a lot of knowledge about it. Do you think you could write a book and get it turned over by, beginning of July? This is, and she spoke to me at the beginning of, June, basically, and said, or middle of May, can you get this book done in 6 weeks? and we'll do all the, we'll get all the editing and everything in, and to give people an opportunity of improving their metabolic health and explaining them the science. And I thought, this is a challenge, but absolutely, there's no time like now to do it, and let's get on with it. So yeah, there was a lot of early sort of waking up at 4:30 in the morning and getting through writing, and obviously doing a lot of my own research as well, new research, looking at immune function and how it links to all the different lifestyle choices, if you like, that many of us make, whether it's about what we eat, how much exercise we do, our stress, our sleep, all of it, all linked to metabolic syndrome and poor metabolic health, clearly correlated with poor outcomes from COVID. So we know, Ivor, that you can reverse many of these risk factors very quickly. And this book is a 21-day immunity plan, and it's not gimmick. It's to change the narrative that we've been trying to do anyway, that dietary changes rapidly improve health markers. Just in the same way, when you stop smoking, your risk reduces very quickly of a heart attack, for example. And to actually give people some hope, but also, it doesn't just stop at 21 days. This is the beginning of your journey. And, I've also written, what do people do beyond 21 days, as well as, what government should be doing. So I think there's a science about what individuals can do. And then there's also the acknowledgement, which again, COVID has highlighted, is that, and I'm quite philosophical in my outlook of life as well, is that we're all interconnected. I mean, this comes from Buddhism in a way, that actually everything that we do is always usually connected to somebody else, whether it's the food that we eat and who's made that, whether it's use of public transport, we're all interconnected, and therefore with such viruses like coronavirus, it has clearly, it's changed the way we live, the way we think, with everything that's happened. And of course, you've argued very eloquently about whether lockdown or should have happened or not, and I think there's a very strong argument for what you say on that. But irrespective, a lot of people have suffered, a lot of people have died, and it basically brought the world to a standstill. And it's likely we may have viruses like this in the future. Why not make the population more resilient? And that's where government need to come in to basically sort the root cause out, which is an ultra-processed food environment, which we've been banging on about for a long time. That the first thing we can do, there are obviously people argue that obesity and all these conditions are complex. They're not really that complex. They're relatively simple. They're multifactorial, but within those risk factors, there is the low-hanging fruit, the biggest, most important one, the elephant in the room, is we need to fix our food. You fix food, you fix healthcare, and very likely you will make your body more resilient to infection.
Yeah, no, great summary there. Yeah, big summary. But yeah, insulin resistance, metabolic syndrome, leptin resistance, and I was delighted to see as well you called out leptin. One of the first people I interviewed actually when I got involved in this corona thing back in April was Dr. Ron Rosedale, and he was trapped in India. And of course he discovered the importance of insulin and leptin in health 25 years ago. He's kind of a bit of a genius. So we had a great interview, but that was exactly the point. He said, not only in a couple of weeks can you drastically reduce your impacts from a corona infection and the cytokine storm, which leptin is a big part of, but within days you can be markedly reducing your outcome if you get an infection next week. Yeah. So within days your insulin can be dropping, your leptin can be dropping, your blood glucose can be dropping, your immune system is going to become more functional within days. Not completely fixed, but within days, better. Yes. And within weeks, way better.
I have a great point. And I think one very strong, compelling piece of evidence to support exactly what you're saying is if you look at the data on poor outcomes from type 2 diabetes. So in general, certainly in Britain, if you've got type 2 and you get coronavirus, your risk of death is double, okay? But if you're type 2 diabetic and you're in that category and you have poor glucose control, compared to someone who's got better glucose control, the risk of death is tenfold higher. And that comes from data that was published looking at people who admitted with type 2 diabetes and coronavirus in China. And exactly what you said is that if type 2 diabetics reduce the starch and the sugar, their glucose control can improve within days. We know that happens. So I think that's a very strong, compelling argument that you can reduce your risk, certainly very quickly. Now, of course, we haven't got the trial data to prove it definitively, but it's so strongly correlated. I think it's more on the naysayers and the detractors to disprove, to be honest, that this isn't going to help your immune system. But even out with that, we're thinking about the whole issue about our healthcare systems being under pressure and stress. And in the UK, the reason we actually went into so-called lockdown, the primary reason, if you remember, Ivor, was to protect the NHS from being overwhelmed. That was the reason. And the reason that they had to do that is because we were already overstretched. We were worried about the next flu crisis coming in December. Is the NHS going to be able to cope? And then this coronavirus comes in. And we shouldn't be in that system where there's no slack. We shouldn't be in that situation where there's no slack in the system. And that is also about how we move forward, how we actually are able to provide quality care to our patients. Now, listen, I have suffered personally, having seen my own mother 18 months ago die prematurely from an infection that infected her spine, that caused a severe pain, that resulted in her having very high doses of morphine. It was a very horrible way for her to go. It was really difficult for us as a family, for her friends to witness it. And I wouldn't wish that upon anyone. And her situation, her health, was rooted in the types of food she was eating. She had problems with excess weight, and then she became frail from arthritis and joint problems because of her excess weight. And by the time she died, her BMI was actually normal, but everything was rooted in the types of food she was eating that made her frail to infection. And we've got to think also about the elderly. The over 65s in particular have a much higher risk of dying from coronavirus. But it seems again to do with the fact that actually, certainly in this country, the general health of our elderly is very, very poor, and it doesn't need to be that way. We want people to age healthily, not unhealthy, which is, the problem we've got is not the aging population, it's the unhealthy aging population, and that's something we also can do something about.
Exactly, and that's so important because some countries like Japan with very low mortality, people say, but they've got a lot of diabetes and obesity too. And I say, yeah, they do in the younger people, but the aged in Japan, the aged are the people who overwhelmingly are dying and being impacted. And in Japan, the aged are extremely healthy. Yes. I mean, there was one study of active aged women in Japan, 95% were above 30 nanogram per mil of vitamin D, which is an excellent sign of metabolic health. And in Italy, where we had the massive hit, it was practically the opposite. 84%, I think, from one study in aged showed they were below 12. Yeah. So these extreme differences in metabolic health in the aged community, that's what gets hit by influenzas and by coronaviruses.
Absolutely.
And
you're absolutely right. And in fact, I mentioned that in the book, and I talk separately. There is a chapter about aging and immunity, because I think a lot of people say, well, hold on a minute, aging is the biggest risk factor. Yes, it is. And that's partly because with age, our immune system becomes less robust, but you can still do something to mitigate that risk, even now, and people can change their lifestyle. And we have to really think about that on a collective population level. It's great. I'm happy the book's doing well. It's a bestseller. Fantastic. But for me, the real purpose, and I've been in direct communication with the Secretary of State for Health and Social Care, Matt Hancock, who contacted me after I'd highlighted that Boris Johnson had gotten well with COVID, to ask me to advise him on the links between obesity and COVID. And I said to Matt, and I think this is another important point, is that it goes beyond obesity. This is about metabolic health, that even up to 40% of people, certainly from South Asian backgrounds, will have poor metabolic health, who have normal BMI, normal weight. So again, let's keep talking about there's no such thing as a healthy weight, only a healthy person, best determined by your metabolic health, which means we're all vulnerable. This isn't just about people being obese. And I think the other thing about the trial data and the studies that we have that show you can reverse metabolic syndrome in up to 50% of people within 21 to 28 days, it actually shows that this can happen independent of weight loss. So this isn't just about reducing weight, it's about improving your body composition, but those metabolic health markers can change even if you don't lose weight. And I think that's a really important message people should, especially because a lot of people who are really vulnerable to this are people with a normal BMI, metabolic syndrome, who over a 10-year period have a 3-fold increased risk of heart attack, stroke, or death in general. So a very high risk. And a lot of those people are from South Asian backgrounds. So the question there is, are you going to tell somebody who literally, is otherwise relatively slim but has the fat in the wrong place, that they need to lose more weight, or are you going to improve their metabolic health? And I say just let's improve their metabolic health and get their muscle mass better, reduce the body fat percentage. Their BMI may not change, but their metabolic health will.
Yeah, no, absolutely a crucial point. We have our TOFIs, especially in Asian groups, where it's thin outside. Apparently the BMI is only 24 or 25 and it's fine, but the little belly is there and the visceral fat inside. And likewise, you can have the big obese person who's metabolically healthy, ironically, with loads of subcutaneous adipose tissue, but actually without visceral fat.
Yeah. I think
The lucky guys.
We need to stop talking about obesity.
Yeah, BMI is out the window.
So this is, again, I'm hoping to shift the paradigm. I've given the markers, you look at your blood glucose, your blood pressure, your triglycerides, your HDL, waist circumference. Use those markers. Everybody can get them measured. They're simple tests to be done. They're probably also going to identify all these high-risk people, as Ivor, for heart disease and heart attacks.
Same thing.
And then, GPs, primary care physicians, should hopefully be using that as a guide to help them identify these patients and then prescribe them a lifestyle prescription. Because what I also highlight in the book, in one of the early chapters, is the limitations of modern medicine. Most of the increase in life expectancy that's happened in the last 150 years has happened because of wider public health determinants, not what happens in the hospital grounds. Modern medicine maybe has added 3.5 to 5 years to a 40-year increase in life expectancy in the last 150 years, my friend. Most people don't know that. They will be shocked when they read that.
And a lot of the people who are in control of the narrative, of course, attribute a lot of these benefits to the endless stream of drugs. But the reality is that's a very small part. As you say, it was hygiene, nutrition, and a whole host of environmental factors changed the world.
Seatbelts in cars, safe drinking water,
the whole lot.
all that kind of stuff.
And
better housing.
Infant mortality stuff and recognition of vitamin and mineral deficiencies that 40, 50 years ago were addressed. That's all forgotten now. People think the magic pills in the little bottle do it. Yeah, they do a certain amount, but don't depend on it.
Absolutely, mate. And of course, people are talking about a vaccine. We don't know whether it's going to be effective. We know that if you're obese, you're less likely to be, the vaccine's less likely to work. We know the vaccines are not as effective in the elderly. And it's still going to be 18 months probably before we get an effective one. So I would argue now, the best vaccine we have, if people are worried about a second wave of coronavirus, the best vaccine we have to protect our NHS in general from all the conditions we've got and against infection is improve your metabolic health, and there's no time to start than now.
Yeah, absolutely. Just like in heart disease or heart attacks, you can beat a statin all to hell by just taking some basic steps, dropping your insulin and glucose. And we know from the science, we have published the statin benefit. It's not zero. There's a benefit in reducing events, especially in people with lots of disease. But we know from the rest of the science that you'll beat the hell out of that with just taking some of the steps to improve your metabolic health.
Absolutely.
I mean, in a head-to-head, it's not even in the race. So listen, that's fantastic. Any last words? It is a bestseller. It's just come out. It's on Amazon, I guess, is like everything.
Yeah.
Any other sources or websites, or no, really Amazon?
Stones selling it. But yeah, those are the ones I'm aware of. Yeah.
Excellent.
And hopefully in bookstores as well if people go in, but a lot of people buy stuff online now. I think, read it, make your own decision, when you read it. It's not a long read, it's probably only about 2 hours, which is great. A lot of people like the fact that they can, read it. A lot of people have read it, very quickly and found and you can read it again and again and pick out, some very good data and points on it. And then the plan, incorporates everything from diet to exercise to fasting to what you do in the long term, and what you can measure and keep track of your progress. And then the very final chapter is actually what we can all do as advocates to help other people and push this message out, to really shift this conversation over so that we are putting lifestyle medicine at the forefront of managing these chronic conditions. So we need to reinforce that as well.
Yeah. And that is the beauty of this particularly, Yassine, because again, democratizing the science without getting too complex and nerdy is what we need to do. And the beauty of this is you can give it to your mother, your aunt, your uncle, your brother who's an accountant who doesn't really like sciencey stuff. It's readable to the masses, which is really important, because a lot of the low carb world that we're in and all, it can get very nerdy and very into scientific analysis. But we need the masses to get this. That's the key.
Yeah, absolutely.
Great stuff.
Great stuff, man.
Thanks a lot, Yassine.
See you. Thank you.
Great. Bye now. Thanks for listening, guys, and hopefully you enjoyed it. And just a reminder that I do need support to continue putting together all of this content. And at patreon.com/Ivor Cummins, or for PayPal at tinyurl.com/Ivor Cummins, where you can do a one-off or a monthly support. So I'd really appreciate that, guys, and keep me getting the science out there and countering perhaps the more biased corporate type science. Thank you.